NHA CCMA practice questions. Question 1. Which of the following measures is a normal specific gravity of urine? 1. 1.025, 1.05, 1.125. Normal urine specific gravity ranges from 1.005 to 1.030, with 1.025 being within normal limits. Specific gravity measures urine concentration and kidney function, indicating how well the kidneys dilute and concentrate urine. Question 2. Which of the following is a disposable glass or plastic tube used for hematocrit determination? Microcollection tube, capillary tube, reagent tube, serum separator tube. Capillary tubes are small, disposable tubes used to collect blood from a capillary puncture for hematocrit determination. They are centrifuged to separate red blood cells from plasma, allowing measurement of packed cell volume, hematocrit. Question 3. Which route of temperature assessment is least invasive? Intranasal, oral, rectal, temporal. Temporal artery temperature assessment is non-invasive, requiring only a scanner swept across the forehead. It does not require insertion into any body orifice, making it the least invasive method while still providing accurate core temperature readings. Question 4. The ratio for making a disinfectant from bleach and water is 105, 110, 120, 1001. The CDC recommends a 110 dilution of bleach to water for disinfecting blood and body fluid spills. This concentration effectively kills bloodborne pathogens including HIV and hepatitis viruses. The ratio remains 110 regardless of measurement units, caps, cups, etc. Question 5. For hearing acuity or bone conduction of sound, the medical assistant would use an otoscope, ophthalmoscope, tuning fork, Snellen test. A tuning fork is used to test hearing acuity and bone conduction through the Rinne and Weber tests. The Rinne test compares air conduction to bone conduction, while the Weber test assesses lateralization of sound to determine type of hearing loss. Question 6. Which of the following is not considered proper patient instruction for obtaining a clean catch midstream urine specimen? Have the patient remove undergarments. Make sure not to touch the inside of the container. Continue to hold the labia apart and void a small amount into the toilet. Clean the urinary meatus from back to front. The urinary meatus should be cleaned from front to back to prevent introducing rectal bacteria into the urethra. Cleaning from back to front would drag bacteria toward the urethral opening, increasing contamination risk and potentially causing false positive results. Question 7. Upon discovering a known diabetic patient who is disoriented and confused, which of the following should the medical assistant do first? Check the vital signs. Give a form of glucose to the patient. Draw a blood glucose. Check for spontaneous respirations. Disorientation and confusion in a diabetic patient may indicate hypoglycemia, low blood sugar, which requires immediate glucose administration. Providing a fast-acting glucose source, juice, glucose gel, or candy can rapidly reverse symptoms and prevent progression to loss of consciousness or seizure. Question 8. A procedure that a medical assistant would not expect to take part in when doing minor surgeries in the office is suture of lacerations, biopsy of the lung, cyst removal, biopsy of a skin lesion. Lung biopsy is a complex invasive procedure requiring general anesthesia and specialized equipment, typically performed in a hospital setting. Minor office surgeries include suturing lacerations, removing cysts, skin biopsies, and IND of superficial wounds, which are within the medical assistant's scope to assist. Question 9. Heart sounds that are heard when the blood pressure is being measured are called the Korsakoff sounds, Rinne sounds, Snellen sounds. Ishihara sounds. Korsakoff sounds are the 5 phases of sounds heard during blood pressure measurement using a sphygmomanometer and stethoscope. The first Korsakoff sound indicates systolic pressure, and the 5th, disappearance, indicates diastolic pressure. These sounds result from turbulent blood flow in the artery as the cuff pressure is released. Question 10. The popliteal pulse is located on the thumb side of the wrist, behind the knee, on the dorsal surface of the foot, at the apex of the heart. The popliteal pulse is located behind the knee in the popliteal fossa. It is palpated with the patient's knee slightly flexed and is used to assess circulation to the lower leg. This pulse can be difficult to palpate but is important for evaluating peripheral vascular disease. Question 11. The most important thing to do to prevent transfer of infectious material is use biohazard bags, dispose of sharps in a rigid container, wash your hands, disinfect patient care equipment between uses. Hand hygiene is the single most important infection control measure to prevent transmission of infectious materials. Proper hand washing removes transient microorganisms, reduces resident flora, and interrupts the chain of infection more effectively than any other single intervention. Question 12. Which of the following types of urine specimen contains the greatest concentration of dissolved substances? Random, first voided morning, clean catch midstream, 24-hour. First morning voided urine is the most concentrated because it has been in the bladder overnight, allowing maximum accumulation of dissolved substances. This specimen is preferred for pregnancy testing, protein analysis, and microscopic examination as it provides the highest sensitivity for detecting abnormalities. Question 13. When moving a heavy object, one should bend from the waist to lift the object. Ask for help if an attempt to lift the object shows that it is too heavy. Make sure that the object is at least 5 inches away from the body. Assess the object prior to trying to lift it and ask for help if needed. Proper body mechanics require assessing the object's weight and size before lifting and asking for help when needed. This prevents injury to the healthcare worker. Lifting with legs, not back, keeping the object close to the body, and avoiding twisting are essential safe lifting practices. Question 14. When removing paper that is soiled with biohazardous waste from the exam table, the medical assistant should do which of the following before cleaning the table with disinfectant and pulling down unused paper? Use sterile gloves. Roll the paper inward and toward the body working from the end of the exam table. Gather the soiled paper in gloved hands and discard. Using unsterile gloves, roll the paper down toward the body and discard. Rolling the paper inward and away from the body prevents contaminated surfaces from contacting the medical assistant. Changing gloves after handling biohazardous waste before cleaning the table prevents cross-contamination. This technique maintains proper infection control and protects both staff and subsequent patients. Question 15. In an infant, you should check the pulse in which of the following arteries in an emergency situation? Carotid, radial, brachial, femoral. The brachial artery is the preferred site for assessing pulse in infants during emergencies because it is easily palpated and accessible. It is located on the inner aspect of the upper arm between the elbow and shoulder. The carotid can be used but is more difficult to locate in infants due to short neck anatomy. Question 16. The generic name for Lipitor is tenolol, atorvastatin calcium, chitral bisulfate, furosemide. Lipitor is the brand name for atorvastatin calcium, a statin medication used to lower cholesterol. Statins work by inhibiting HMG-CoA reductase, reducing LDL cholesterol production in the liver. Knowing generic equivalents of common brand name drugs is essential for medication reconciliation and patient education. Question 17. After a patient has had a grand mal seizure, one would expect the patient to be confused and drowsy, excited and hyperactive, hypotensive with a decreased pulse, in need of airway management. The postictal phase following a grand mal seizure typically involves confusion, drowsiness, fatigue, and disorientation lasting minutes to hours. This recovery period is normal after the intense muscular activity of the seizure. The patient should be placed on their side to maintain airway patency and prevent aspiration. Question 18. The most appropriate position for a patient with respiratory problems is Trendelenburg, Fowler's, lithotomy, dorsal recumbent. Fowler's position, sitting upright at 45 to 90 degrees, promotes lung expansion by reducing pressure on the diaphragm from abdominal organs. This position allows gravity to assist with breathing, improves oxygenation, and is ideal for patients experiencing respiratory distress. High Fowler's, 90 degrees, is often used for severe breathing difficulty. Question 19. Which of the following is not a normal vein for venipuncture? Cubital vein, brachial vein, hepatic vein, cephalic vein. The hepatic vein is located in the liver and not accessible for routine venipuncture. Common venipuncture sites include the median cubital, cephalic, and basilic veins in the antecubital fossa. The brachial vein is deeper and less commonly used but is not contraindicated. Hepatic vein access requires specialized procedures and is not within the medical assistance scope. Question 20. Which of the following situations would be of least concern when involved in a sterile procedure? Talking over the sterile field, loose uncovered hair on a member of the sterile team, a non-sterile person entering the room, adding non-sterile items to the sterile field. A non-sterile person entering the room does not directly contaminate the sterile field if they remain at a safe distance. However, talking over the field, loose hair, adding non-sterile items, and torn gloves are all direct contamination risks that compromise sterility and require immediate correction. Question 21. Draping is done primarily for convenience of the doctor, keeping the patient warm, patient privacy, convenience of the medical assistant. Patient draping is primarily performed to maintain patient privacy and dignity during examinations and procedures. Proper draping exposes only the area being examined while covering sensitive body areas, which helps reduce patient anxiety and promotes trust in the healthcare provider. Question 22. To take the blood pressure correctly, the medical assistant should use any blood pressure cuff that is available as long as it fits the patient's arm. Have the arm at or near the level of the heart. Pump up the cuff until the pulse is no longer audible. Release the air from the cuff rapidly in order to decrease patient discomfort. The patient's arm should be supported at heart level to ensure accurate blood pressure measurement. Arm position above or below heart level can falsely lower or elevate readings respectively. The cuff bladder should cover 80% of the arm circumference for proper sizing and accurate measurement. Question 23. A person who has difficulty breathing and experiences swelling of the respiratory tract following a bee sting may have myocardial infarction, anaphylactic shock, obstructive airway disease, cardiogenic shock. Anaphylactic shock is a severe, life-threatening allergic reaction causing respiratory distress, airway swelling, and hypotension. Bee stings are common triggers. Symptoms develop rapidly and require immediate epinephrine administration. This is distinguished from asthma by the rapid onset and systemic nature of the reaction, including possible hives and gastrointestinal symptoms. Question 24. Which of the following is not a true statement regarding tuberculin testing? A small amount of tubercle bacilli is administered intradermally. The results are read in 48 to 72 hours. Induration is a positive indicator of disease. A person who has been vaccinated with BCG will test positive. Induration, hardened swelling, indicates exposure to tuberculosis or vaccination, not active disease. A positive PPD test requires further evaluation with chest X-ray and possibly sputum culture to determine if active TB is present. The PPD cannot distinguish between latent infection and active disease. Question 25. Which one of the following is not a proper procedure for performing the Multistix 10 reagent strip test? Immediately recap the testing strip bottle. Do not touch the strip with your fingers. Hold the strip in a vertical position. Completely immerse the strip in the specimen. The reagent strip should be held horizontally, not vertically, after dipping to prevent reagent migration between pads, which could cause cross-contamination and inaccurate results. Proper technique includes complete immersion, gentle tapping to remove excess urine, and comparing to the color chart at the specified time. Question 26. Which type of thermometer should not be used in the medical office? Digital, disposable, glass, infrared. Glass thermometers containing mercury are no longer recommended for medical offices due to toxicity and breakage risks. Mercury exposure can cause serious health effects, and broken glass creates Sharp's hazards. Digital, disposable, infrared, and tympanic thermometers are safer alternatives with comparable accuracy.